Hi class, this week we talked about discrimination. I feel that discrimination happens a lot, especially with patients towards their providers, and it's not something that there typically is a policy for. Of course, organizations have policies in place to prevent discrimination when hiring, but I feel like we don't give a lot of thought to what happens when our patients are being discriminatory towards us or our staff. So this module was definitely eye-opening and gave me an opportunity to look into what I would do if I came across this situation. So to answer the first question, as the Human Resource Director, what would my recommendations be for handling this dilemma? So I would discuss with the patient's mother and ask her why she would only like Caucasian staff. Maybe she has had issues in the past. Maybe she's been to another facility where she dealt with one staff member in particular and associated that negative experience to that person's ethnicity. So I would make sure just to ask in a very respectful way as to not make the situation worse. If there is a reason, a history behind her only wanting Caucasian staff, because if it is something based on the history of her care, then it could possibly be something that could be corrected. I would explain to her that we have a very diversified staff and that we could try and accommodate her request. However, during the current shift, we might not have enough nurses to tend to her son's needs, and would it be possible, if there was not a Caucasian nurse available, if another nurse or provider took over? And see what she said with that. If she was not satisfied, we could recommend to her that we could transfer her son once he was more stable. However, I would also let her know that the nearest children's facility is 3 hours away and that there was no guarantee that they would be able to accommodate her request. So I would also explain to her that if she did decide to do that, that she would have to sign forms stating that she was leaving against medical advice, or AMA. And after all of this, and after we hopefully either were able to keep the patient or perhaps stabilize her son to the point where he could be moved to another facility via ambulance transport, or was okay enough to go home and maybe seek treatment with a primary care provider, after that, then I would definitely get with my administration and my management team and try to develop a plan for future occurrences. The next question asks, how would the adherence of the patient's request impact the following persons? The patient and family, the staff and nurses, and the Human Resources Department. So if we were able to adhere to the patient's request, the patient and family would most likely be satisfied that they were only being treated by Caucasian individuals. However, if the hospital was short-staffed of Caucasian providers, then their quality of care may not be as high as it typically would be. So they might be happy that they're only seeing Caucasian providers, but maybe his care, maybe he doesn't get checked on as often, and maybe they're unsatisfied with the level of care that they're receiving. The staff nurses and caregivers may feel resentful towards the patient and the family, and also against the administration because the administration decided to honor their request. And it could be sort of, the staff could feel that it's sort of a can of worms opening in regards to allowing more racist and discriminatory patient requests in the future. So they, might feel like their safety at work is in danger because the administration is allowing the patient to be sort of blatantly racist. The Human Resources Department may see a sudden decrease in staff. Ethnic staff, as I stated, might feel like because the administration allowed the patient's request, that the administration is not willing to stand up for their diversified staff and they don't feel safe, so they're going to start seeking other employment, which is going to leave the Human Resources Department struggling to find individuals to fill those spots. Lastly, to discuss a policy statement to address future occurrences of the request. My proposal for the policy statement would be as follows. The purpose of this policy is to outline the Mercy Family Hospital's procedures for when a patient requests harassing, discriminatory, racist, sexist, or otherwise offensive requests related to their care. Mercy Family Hospital employs approximately 3,000 employees representing over 73 countries. We promote and encourage cultural diversity while holding patient care to the highest standards. Both patients and providers must work cohesively to secure positive outcomes. Discrimination negatively impacts this relationship. Discrimination also lowers morale of staff and promotes an unsafe work environment. To ensure effective and efficient care without jeopardizing the safety of our staff, Mercy Family Hospital is implementing a zero-tolerance policy for patients that are discriminatory towards staff. Mercy Family Hospital will continue to accommodate and respect those patients with religious belief-based requests. However, if patients do not adhere to the expectations and standards in this policy, they will be respectfully asked to find another provider to service them. So basically, to sum up this whole discussion, as I stated in the beginning, it's something that we in healthcare don't have enough policies for. Working in healthcare myself every day, I see where individuals come in and unfortunately sometimes they are racist to our staff, or not even racist, but just misconduct in general, where they'll curse at you, they'll be very violent towards you, and there really aren't very many procedures in place to handle those types of situations. So I think as healthcare administrators, we need to be more cognizant and not be afraid to stand up for ourselves, even though we're taught and we want to help patients. And that's our ultimate goal, is to provide excellent healthcare to these individuals. We can't jeopardize our own safety to accomplish that. So I think it's definitely a discussion point that needs to be brought up to start establishing policies that will protect our staff against patients who can sometimes just be rude and discriminatory. So I hope everyone has a great week, and thank you for listening.